Allora chiamiamo Giuseppe Reppucci e Simon Barnard to speak about photo-ophthalmic technology.
Okay, good morning. Today I'm introducing a new automatic photo-ophthalmic device to objectively measure eyelid position. The VOLK EYE CHECK is an automatic device that captures, analyzes and displays a range of significant and important data related to the eye and to the eyelid position. In the next slide, you will see how easy it can be measure important eye features and parameters compared to the past.
VOLK EYE CHECK is a standalone ophthalmic screening software intended to measure ophthalmic characteristics and aid in the diagnosis of ophthalmic abnormalities. Eye care specialists, such as ophthalmologists and optometrists, as well as other trained professionals, can use this device. The measurements provided are to be interpreted by the qualified professional in conjunction with other tests to aid in proper diagnosis. A report is generated which can be attached to your electronic medical records for easy documentation.
So as you saw in the video, the acquisition is very easy to take. You just need 2-3 flash photographs. This is a real-time analysis. That means that all the data collected are displayed on the device and can be instantly uploaded as a PDF to a medical record on a PC or tablet if you're connected to Wi-Fi. There are 3 different models that are provided by the device and can be used in 4 different areas of clinical use. The first model is the oculoplastic models with a free-from grid, but there are also 2 more models. One is for the contact lens fitting and the other one is more screening. The device, as you saw, it's very easy to use, very important to have a bright area, and the clinician should place a hypoallergenic calibration sticker on a patient's forehead. This is very important to get very precise acquisition. Just put patient's ID and age on the touch screen and select the model, in this case the oculoplastic that we want to use. The camera should be pointed at the same level of the eyes, about 50-60 centimeters from the patients. The touch screen is very easy to understand, very intuitive, just follow the screen instruction. The process is as easy as taking a picture with any kind of smartphone. But we all know how accuracy is important in the measuring process. So the device was compared with other instruments that are actually used to measure fixed anatomical features such as horizontal visible iris diameter. And accuracy found of the HUD was within 0.1 millimeters on average compared to many topographers. Here we can see the study carried on by the Michigan College of Optometry at the Ferris State University in the USA. We know that there is actually no gold standard for the HUD measurement. So all the instruments, the device in this study, have been tested to compare the accuracy. The study concluded that this device allows for completely objective ocular measurement and produces results that are very close to the average of all the measured device tested. And it also produces highly repeatable measurements between examiners. But what we are really measuring with the device, after each acquisition, the device produces a PDF report that shows a number of data related to the lid and the lid position. We basically have 2 different types of data reports. So we have a fully objective measurement that includes the MRD1 and the MRD2, but also we have the distance from the upper lid to the limbus and the lower lid to the limbus, both for the temporal side and the nasal sides. This is how the patient's report's layout looks like. It can be visualized on a screen, printed, or you can send it by mail. And here we can see all the measurements that we get after the acquisition for the right eye and the left eye. We also have the pupil diameter, the HUD, the horizontal and vertical pupil eccentricity, the palpebral aperture, and aperture at the limbus, both for the temporal side and the nasal side. So it's very important to know how the device works. The technology uses the Purkinje image as a reference point. So after each acquisition, what we are doing is trying to measure the margin reflex distance as a main point. But when the Purkinje image is obscured, for example, if we have apoptosis, the automatic measurements will be not calculated. But in this case, what we can do, there is a grid image generated that is used to manually measure lids, creases, or brow. But let's see what this grid image is. The second type of data report that we have includes an high-resolution overlaid grid with one high-resolution photographs that is generated by the software. This is very important for measuring landmarks such as brow position or margin crease distance. Here we can see clearly the overlaid grid. Each dark square, the big one, represents 5 millimeters for 5 millimeters on a patient face, whereas each lighter square, the small one, represents 1 millimeters for 1 millimeters on patient face. These allow clinicians to directly measure any other points on the lid or on a patient face as required. We can see here the high-resolution photographs with the overlaid 5 millimeters and 1 millimeters grid in the patients with a thyroid eye disease. The picture can be zoomed in and all the features can be manually measured, such as lids, brow, or crease position. Just a few important observations to do. We know in our experience that the device produces very accurate automatic measurements in patients with normal lid position, lid retraction, and partial ptosis. But we know that even if the Purkinje imaging is occluded and the automatic measurement will be incomplete, the JPEG image with the grid will help for easy documentation and manual measurement. What is important, in conclusion, what we can say, the device is a very good routine way of capturing and measuring lid position, thyroid eye disease, but also in any other kind of eye condition. We can precisely measure the lid position when the Purkinje image is not occluded, as I said. But thanks to the JPEG high-resolution photo plus the overlaid skill, we can easily manually measure all the other features. Photographs can also elucidate abnormalities of the eye structures more clearly than charts, notes, or drawings. All the information that we collect can be very important in a pre- and post-surgical comparison and can be used to identify changes in patient conditions over time. As I said, all the information plus the high-resolution grid and the photographs can also be very useful for documenting lesions. Thank you very much for your attention.